I am so glad to be here today in Bridgeton meeting with our experts, Allison and Susan, to talk about the opportunities that we have to work with women in our community. And one of the things that I love the most about this is it came from experiences in past parts of their lives and in different jobs in Inspira. And so Allison, Susan, thank you so much for letting me come in and be with you today in your home in Bridgeton. So tell me about our program and tell me about why it means so much to you.
So you're right, it did start from a very dear place in our hearts. And so as you referred to, I used to work in Woodbury back when it was Underwood. I worked in the prenatal clinic, so it was all pregnant women, and then we would see them up to 6 weeks postpartum, and I was a social worker there. And I kept seeing anxiety, trauma, stress, just a lot of need.
In the postpartum area specifically, or all through?
Pregnancy, postpartum, everything.
Yeah.
But a lot of people wanted therapy. They wanted to be able to talk to someone. They never had the opportunity to talk to someone. I would try to find perinatal therapists that could talk to them about what was going on for them during that period, because it's different when you're pregnant, when you're postpartum. And Susan and I started talking about, this population.
Yeah. And then what happened next?
So we started wanting to just make it an easier process, that a patient could be sitting in their OBGYN office struggling with something related to pregnancy, postpartum, and they could send us a referral directly and we would reach out to them to make an appointment.
And so we were like, all right, we're gonna send an email out to all the OBGYNs and midwives within Inspira. Like, that's just where we're gonna start. We sent this email out, we're like, hey, we're trained, we're certified, start making referrals.
We were getting a lot of referrals from OBGYN providers, and that's part of what we really wanted to make possible through this program, like that people can easily find care, that it's accessible, that there's not stigma associated with it. But we currently have 6 trained therapists now. Started off just Allison and Ahayan. We've been able to get some of our other therapists to get the special training through postpartum support. We also have 2 advanced practice nurses who can prescribe medication. We work with women and families on all parts of like the reproductive journey. So pregnancy, postpartum. We also see individuals who have experienced the loss of a pregnancy. We also support people who are experiencing fertility challenges. We do have a baby-friendly space available with changing table, rocking chairs, for them to feel comfortable.
Yeah. Toys for their toddler, if they have a toddler to come in, we have healthy snacks.
I'm not sure I really want to come in person. Can you do telehealth?
Absolutely, we could do telehealth.
And that works for a lot of new moms, like with
they
a
got the baby,
newborn, they don't want to have to go out.
Yeah.
There's so much pressure to feel like I should be the perfect mom. I should love every moment of this experience. And the truth is, there's a lot of really hard days and there's a lot of moments that you don't love. Just normalizing that there's hard days, that you can be overwhelmed at the same time as really loving what's happening.
And when they can start to have self-compassion, that's when they start to trust themselves and say, wait, I'm a good mom. I can do this.
And one of the things that I know that you guys are both passionate about is this is not a quick fix, right? This is not about coming in for, the first few weeks or coming in a few weeks after. There are times when you need this expertise to go with you for a while.
Like Susan said, they're on the reproductive journey. Let's say they're having trouble getting pregnant or they're thinking about getting pregnant. Yep, we'll see you. Let's say they are pregnant. They're nervous about something. Yep, we'll see you. They have a loss. There's no judgment about any of it. We even have patients who unfortunately have had like an early delivery and then they had a live birth and then lost the child. We see them. They need that trauma-informed care.
Yes.
And what happens all along their journey, what happens in their childhood, it all matters.
And we just want people to know that the support is here, that mental health care should be part of perinatal mental health care and it should be available to everyone. And we've really appreciated connecting with so many other professionals across Inspira, like the providers, the OBGYN, the midwives who will send us referrals for patients that they're concerned about, that they feel that could benefit from therapy. The inpatient social workers on the maternity floors who see all the moms and sometimes you can't articulate all the words, but you see it, right?
I know what it looks like. You know what fear looks like. And so just being able to have those professionals say, I'm going to get you to somebody that's going to help you.
Right.
And it happens because of people like you in environments like this. So thank you for all you do. I'm so grateful.
Thank you for coming to see us.
Yeah,
It's my pleasure.
we just want people to know we're here and support is available. They're not alone if they need it.
And they belong here.
Yeah. Yes.
We got them.
We got them. That's exactly what we all want to know.